welcome to the Simplicity of Health podcast. I'm Brandon Vanderveen. I'm a PhD. And today's podcast, I had the pleasure of talking with Dr. Keith Brazendale, also a PhD. Keith did his bachelor's degree actually in Edinburgh, Scotland, at the University of Edinburgh. He did his master's in exercise science at Florida Atlantic University, and then his PhD actually at the University of South Carolina in the exercise science department. And that's actually where I met Keith. We both were at the University of South Carolina around the same time. He worked downstairs from me for a childhood obesity and physical activity researcher named Michael Beets, who's fantastic, well-respected in the field. And so that was kind of the general topic of today. Keith has since taken a tenure track position at the University of Central Florida. So he is an assistant professor there in the Department of Health Sciences. And today's podcast, we got into what is Keith's structured days hypothesis. So we talked about how he views health in a very general sense and how maintaining a structure to your day or to your child's day is really helpful in developing healthy behaviors. We also discussed how approaching health from just one angle or a myopic approach towards health is really not the best way to do it. So while we focus a lot on physical activity, it really does, we do need to incorporate physical activity, mental health, diet, and your own, Keith will explain the structure to your day, how you're having these rhythms and getting in this structure to where your body knows what to do. And how that can really impact all of your life, as well as some obesogenic behaviors. I actually don't interrupt. I didn't feel a need to interrupt throughout the entire podcast because Keith does a really good job of explaining it in a pretty simple format, and it all is pretty intuitive. At one point, we get into circadian rhythms, which all you need to know about that is there's just these intricate parts of your cell that actually is on its own rhythm or a diurnal rhythm to where it knows what time of day it is based on a lot of different factors. But it was a lot of fun talking to Keith. I really appreciated him doing it. And I hope you enjoy the podcast. Thank you very much. So let's get started. So the first question I like to ask everybody is, what is health to you? How do you define health, and how do you kind of incorporate it in your own life personally and professionally?
Right. Well, I would say for me personally, health is balance. And you can take that at the broadest meaning, or you can take it all the way down to a very specific example of maybe something like how much sleep you get on a regular basis, right? For me, health being balanced is to do with maintaining structure around your lifestyle on a daily basis, whether it's a weekday, a weekend, whether you're on vacation, balancing, all the things that life throws at you and finding time to do things that you enjoy and obviously keep you healthy is such a task nowadays that I think, we shouldn't just focus on, well, what am I eating, right? Or I need to get my exercise in today. It's really taking care of the whole spectrum of things: sleep, activity, eating, mental health. Are you doing things that you enjoy? I didn't want to say, health is a state of mind. It's a state of body. I mean, it's a state of everything. It's, you're really bringing out the philosophical side of me here, but it really is, and it ties back to balance and having everything operating, kind of at the level it should. And it doesn't mean extremes. It's not going crazy by exercising crazy every day, and it's not going very strict on a diet, and it's not, forcing yourself to go to bed at the correct time. And those are predominantly the areas that I focus on in my research. It's more of them finding the optimum level for you as an individual, where you can live a healthy lifestyle, where you're not feeling like you're constantly, running a rat race to find optimal health, right? You're finally you found your own health, right? And that sounds very out there, but that's, to me, that is health. And everything that I've kind of studied within the field of childhood obesity is kind of pointing towards how structure and routine and balance for children is really what they need. And as adults, we need it too. And I think nowadays, especially with COVID-19, we're finding that, the ship has been rocked. It's thrown us off probably mentally and physically in terms of our health. But I think now we're in it to a point, we're 6, 8, 10 weeks into this, we're beginning to find a new normal. And people are probably, if we're looking at this on a chart, we're probably now trending at a nice new level that's different from what we were before COVID-19. But it was a little bit chaotic at the start.
But it's a good point. It's like a lot of people tend to obsess in one area or another, and a lot of public health people would never say an obsession is a good thing. You can have a lot of health benefits from it. Like if you're obsessed with exercise, you'll have some health benefits, but it will overtake your mental health. It may overtake your job. It may. So there's something to maintaining a structure and a balance between good things and understanding how they all kind of incorporate together.
That's it. That's exactly it. And it's kind of how we're, a lot of what we read and see, and a lot of the information we're given would tell you to perhaps obsess on one of those, right? We'd see, oh, you must do these, workouts. Please, do this crash diet. What I would always promote is, can you do something? You need to choose a lifestyle that you can maintain for, into your later years.
Yeah, and that's one of the themes of other podcasts is like if you decide that it's the best thing for you, you're much more likely to sustain that change. And it's not like as soon as you're told, oh, you got to do this Whole30 diet or you got to do these extensive training regimens, and it's like for a couple of weeks, and then you either get sick of it, you get bored, or you hurt yourself, and it's like well, then you're right back to where you started, and you have to have something that can be sustained.
And that's sometimes the question I get asked by some students is, what's the best diet? It's like the one that you can maintain forever, literally forever, right? And my wife asked me, at the start of every month or every year, let's do Whole30. I'm like, no, let me just continue on my life. Like for, if it's to go for a short-term gain in something, sure. There are diets out there that can do that, or there's lifestyles, you could say behaviors that you can engage with that could meet a certain short-term goal. And if that's the goal, that's great. But, if perhaps it's, getting to, like fighters do it, you need to make a fighting weight. Or maybe you got a wedding coming up and you want to look extra great in your suit. Fine. I have no problem with that. But if we're talking about maintaining optimal health, into your later years, you got to find something that you can maintain. And it's all about balance, I think. So,
well, and it's such an important point in fields of public health. We would never just suggest, public health experts never suggest drastic diet changes or anything. Like we'll examine them of like, hey, what does this 6-week paradigm do to this outcome, or what does this diet do to this outcome? But like if we're actually promoting healthy lifestyles or anything, it's never you need to do this specific thing. It's like general broad guidelines of like you need to be active. You don't need to do this particular exercise. You just need to be active. You don't need to eat necessarily 100 grams of spinach, but you do need to eat leafy greens. You don't need to have these particular proteins, but you do have to have protein. It's general, sustainable diets and exercise and habits. It's never specific when we talk to the general public.
No, it's not, and it shouldn't be, because you want people to take that and find their own comfort zone within each, right? So, the guidelines out there, and it'd be interesting to know if how many of the public actually know that these guidelines exist, but often it's they kind of fly under the radar. But the guidelines from a public health standpoint are always very broad, And I think that's a good thing. So people can tailor it towards their needs, right?
Mm. Which always brings up, and I love discussing this topic of the idea of do what's best for you, or
Mm-hmm.
listen to what your body's telling you. And
Yeah.
I particularly hate that, because I think that could be extrapolated to, well, I'm craving Skittles. Well, listen to your body. You should eat the Skittles. And it's like, no,
Yeah.
it's
Yeah.
not necessarily like, and if you have addictions, it's like, no, don't
Yeah.
listen to those addictions. But it
Yeah.
is grounded in some truth of like,
Mm-hmm.
I can't give you the same exercise prescription that I can give
Yeah.
somebody else who
Yeah.
has diabetes per se. It's like,
Mm-hmm.
you have to, it has to be individualized, but
Yeah.
there are broad concepts that we do promote.
Yeah. Yeah. For sure. Um, the listening to your body thing is yeah. It's kind of playing, like you said, playing with fire a little bit, right?
Totally.
Once you're used to it, it's a great mechanism. You know, if you're tired, maybe you should take the extra couple of minutes in bed, and not exercise that morning. You don't feel like exercising, but then you can get on a slippery slope there, perhaps. But you the more that you go into this, and you find your comfort zone, you find that balance. The more you realize that what's kind of good and bad, what works for you and what doesn't. But generally, like to revisit the guidelines, generally those are there for you to make your own personal choices, like a little personal toolkit to keep you on the right path. And none of them, like you said before, none of them are talking about extremes, and none of them are hitting home some hard specifics, right? Like you must do these exercises, you must eat this. Um, this is the way you must sleep, that type of stuff. So
Yeah.
yeah,
Well, and when you're saying guidelines, you're referring to the 90 minutes of MVPA, moderate to vigorous physical activity, those kind
yeah,
of
well,
the
yeah,
ACSM guidelines.
so you have sleep guidelines. So we have sleep guidelines for adults, for children. For adults, we should get 6 to 8 hours a night. So again, that's not very specific. There's a large difference between 6 and 8, right?
Oh yeah.
Um,
It's a whole REM
children,
cycle even.
what's that?
I said it can be a whole REM cycle even for some people.
Exactly. Yeah. Yeah. And then obviously there's the USDA have the whole My Plate guidelines of can you touch on these macro food groups, right? You get your vegetables, get the starches, get the proteins in. We're not telling you specifically where you get it from. They give you examples. And then for exercise, it's muscle and bone strengthening activities. Again, that's very broad, but there might be, and it needs to be broad for different populations. And then can we get some aerobic activity in, right? Can we get the heart and lungs going? And for children, it's 60 minutes a day of moderate to vigorous physical activity. So that's really anything above a jog. And for adults, they break it down 150 minutes a week. So you could essentially do your 150 minutes over 2 days, they said, as per the guidelines, or you could break up into 5 days of 7. You do 30 minutes a day and you go for a brisk walk. So that's kind of like that's like the starting point, I think, for what you could say the CDC and the World Health Organization, all these, they all pretty much follow the same suit for these guidelines. That's where they would say, if you want to find health, start here. Obviously, there's nothing there in other aspects of health, such as mental health, emotional health, but those aren't my areas of expertise. So that's those do exist, though, I'm sure.
I'm sure. Yeah, it's tough to think about what a guideline for your mental health is, which
Yeah.
is interesting. It's probably needed, because one of the biggest things that jump started our field of exercise physiology was kind of our where we got our PhD, and them actually giving guidelines and getting policies in
Yeah.
through the government, or whatever way you
Yeah.
would
Yeah.
actually say that, of getting policies of like, hey, we can promote healthy lifestyles by just getting 150 minutes of activity. What does that look like with mental health? You need a guideline. You need to at least have 60 minutes of quiet time and meditation
Quiet
every day.
time, staring at a nice picture. Like, yeah, what are some of the examples that they would give in those documents, right?
Yeah, but it's so important. I mean,
Yeah.
we can't discount how
No.
important sleep is to your mental
Hmm.
health. And yeah, I
Hmm.
guess getting 8 hours of sleep is one of those mental health guidelines. But yeah, that would be a tough field to crack.
Yeah,
Um,
I know. I should
or
ask my
tough
wife. She's
polish.
a psychologist. She probably could point us in the right direction. But
Have some
um,
guidelines.
yeah, some guidelines for mental health. But
Well, and also mental
yeah.
health, such a big field of, yeah, I know your wife works with autism, the
Hmm.
spectrum, correct? Like just
Yeah.
dealing with that spectrum versus just depression, anxiety. It's
Oh
like
yeah.
there's just as many of those diseases as our obesity related disease,
Yeah.
or
Yeah.
obesity related, or
Yeah.
physical activity related diseases as
Yeah.
well.
Oh yeah. Yeah. And yeah, and it always crops up in the research that I do, because a lot of them are tied to activity, right? A lot of studies that are conducted look at how sleep and exercise and diet can actually improve some of those mental health, outcomes. So it's they're closely related and interrelated, and both just as important as each other, you could say.
Isn't it? I always find it funny because I do a little bit of quality of life work as well,
Hmm.
and so much of mental health and overall health is relegated to these questionnaires
I
of,
know. Yeah.
on a scale from 1 to 10, what number are you, as
Yeah.
to I feel happy in the morning, I feel sad in
Yeah.
the morning.
Yeah.
Circle or put a line
Yeah.
where you're closest to, or something like that.
I mean,
Like,
you could be perfectly in a great mental health state, but just wake up that morning like, I'm a four, you know, and that's you now classified on the mental health scale as the other, on the low side, but you're fine. But it's just a function of the tool, right? It's
yeah,
not a valid, maybe it's not a valid measure of. It has been deemed valid, but we have to question its validity. Is it really
yeah.
measuring mental health,
Well,
right?
so it brings up some lot of tough words of validity to
Oh
validate.
yeah,
I think you said valid 3 times. Um,
valid.
but yeah,
Yeah.
it's
Everything
such
throws
an
around valid.
yeah. You have to validate your tools, your mechanisms, your whatever, and it's such an interesting. I mean, that is what scientists, we want to be reliable and
Yep.
valid and reproducible, as well as rigorous. All these dumb science words.
Yeah,
Um,
yeah. And I had a mentor, great mentor, who defined validity as the soundness of the inferences of the tool. And I was like, that doesn't really help me. The soundness of the inferences of the tool. But basically, what it's getting at is, does it measure or does it capture what you want it to or what it's supposed to?
exactly.
Right? So, like if I have a device that I put on a child's wrist that's going to measure physical activity, we often, use these. But let's say someone gives me a new one and I'm wanting to find out how active a kid is for a whole day. I'll put it on their wrist. It might give me some crazy numbers. And I might look at it and be like, now is this accurate enough? We have to compare this to a gold standard, or the optimum measure of physical activity, which at this point is something called doubly labeled water, but now we're really getting into it. But
Yeah.
it can be way off. So we have to really question the measures that we use, whether it's physical activity or mental health or whatever we're going to look at, and ask ourselves, okay, is this truly capturing what we think it is capturing? Or is there
But it's
something perhaps wrong with the device or the tool? So that's often why we'll see lots of studies out there that do validity studies just on measurement.
Yeah. Well, and it's such a limitation of science in general.
Yeah.
And we could really get in the weeds of the philosophy behind the scientific process. Just
Hmm.
we have to use what's been previously established or published
Yeah.
to understand what we are currently, or to we have to use what's been
Yeah.
previously published or studied to study what we want to study in the future. Even it
Yeah.
doesn't matter if that may be wrong, but that's what we
Yeah.
have to use.
That's
Like
all
you
we
can,
have. Yeah.
yeah, you can't just say no. that 50 years of work is just wrong. Like you have to come, like you need a monumental paper in order to say that may
Yeah,
not be the best thing, but then you're going to
yeah.
be just absolutely ripped to shreds.
You're trying to, you would have to shift, the whole field.
Yeah. Well, and I remember a conversation that you and I had a while ago about just kind of, I don't want to say the old heads in a derogatory term, but
Yeah, yeah,
like there needs to be a paradigm shift in physical activity research of
yeah,
maybe it's not how much activity they're getting, but it's how much sedentary behavior
yeah.
that these kids are having, and getting someone who's been researching childhood activity for 45, 50 years with the idea of how many minutes are they exercising,
Yeah,
convincing them that that may not be the best measure is
yeah.
going to be a nightmare.
Well, yeah. I mean, you're ultimately asking them to I wouldn't say discredit, but almost, reflect on a body of work that they've fully believed in and say, listen, maybe this isn't it, right? But you could look at physical activity and say that we've made relatively small gains, I'd say, in really, increasing children's physical activity in the United States, and now we're going down another avenue. But I'd say we've really made small gains the last 20 or 30 years. So maybe exploring children's levels of moderate to vigorous physical activity on a singular focus, just that as our main outcome, as our main thing that we're interested in looking at, maybe we need to leave that alone and start looking at maybe how other behaviors interact with each other to make this whole health profile. So how is sleep and physical activity and diet all and sedentary time all interrelated on a 24-hour basis for a child's health? Not just, oh, a child was active today, the child met the guidelines, great. A child could meet the physical activity guidelines on any given day, but then they could have a really poor diet. They might not have slept properly, so therefore they'd still be gaining weight. Therefore, we'd still have a childhood obesity epidemic, but all the children are meeting the guidelines. So we can't be singular focused on physical activity, right? We need to
Hmm.
sort of, and we're shifting. There's a slow shift. The last few years, 24-hour movement behaviors have been released. The United States is actually one of the last governments to jump on board with guidelines, but Australia, Canada, the UK have all come out with 24-hour movement behavior guidelines. And
Interesting.
this relates to physical activity, sedentary time, so how long you sit for, and sleep. Those are the three things you can be doing with every minute of your day. You're either standing or sitting, that's sedentary. You're either moving, right, or you're sleeping. That's how we can account for every minute of an individual's day or child's day. And they're calling on researchers to start exploring the interaction, right? Because it's all about time use. Oh, well, if I'm more active, that means I'm less active in another segment to be sedentary or to sleep less. Or let's say I slept for 10 hours. That means I only have 14 hours left of that day to be active and to be sedentary. So it's all about time use now and how each segment, sedentary activity and sleep, influence each other. We can't look at things on a singular level anymore, or like what I like to say, like just one outcome, which used to be physical activity. It's really now looking at how they all interact with each other. And we have the devices that can measure that. Whether it's valid or not is another question, but we have ways to do that.
So I wanted to go back. You mentioned that like the last 30 years with this somewhat myopic approach, we haven't moved much.
Yeah.
When you say that, do you mean we haven't seen progress? Even the people who are getting those guidelines aren't increasing their health outcomes, or do you mean that like the field, our understanding of that is just kind of plateaued
Yeah.
and we're not really growing?
Yeah, so what I mean by that is, if you look at the trends of obesity in the United States, and let's just say children, for example, it's in the last 50 years, it's gone up fivefold. So on the back of that, we typically go to two things. Okay, kids aren't moving enough or diets are poor. Now, I've had more experience on the physical activity side of things. So what do we try and do? We measure children's physical activity to see, okay, where are we at? We've done this We see that children aren't meeting the recommendations, which is 60 minutes a day of MVPA, moderate to vigorous physical activity. So I think the last comprehensive, you could say, landmark study that looked at a, a large sample of US children, over 3,000, using a device, right? So none of this was self-report, found that only 40% of children aged 6 to 11 actually met that guideline of 60 minutes of MVPA per day. So on the back of that, they were like, oh, we need to do something about this. Let's start doing interventions. Okay, let's go into a school. Let's go into a sports club. Let's get kids more active. So we threw millions and millions of dollars. And when I say we, I mean the scientific field, at projects to try and improve children's physical activity. The whole body of work that we spent money on, if we took all of that and we did something, we do something in research where we want to summarize it all to get one outcome to see how effective we've been as a field. It's called a meta-analysis. That was done on 20 years of physical activity interventions, and we moved the needle. We increased children's daily MVPA by 4 minutes a day as a field. That is just extremely underwhelming to me. And just, is it wasted time? No, because it's actually shaped a lot of what we've done in the last 5 to 10 years and what we will do. I think we've eventually found that it's hard to get children to be more active if physical activity is your primary outcome. But again, let's remove ourselves from why we started this in the first place and take a bigger look. We started this because we're concerned about children's health, right? Childhood obesity. So we need to start considering other things that are associated with obesity. Sleep's become right to the forefront of research. I'd say it's been chasing physical activity for the last 10, 15, 20 years, and now it's right in line with it, if not overtaking it as an interest of mine specifically. Diet's obviously very important, but diet is extremely hard to measure in children. And now I'd say the last 10, 15 years, sedentary time, how long you sit for, right? So some people may argue, oh, well, if you're being active, then why we care about sedentary? There are so many studies out there that show independent, right? So even if you are supremely active, if you sit for a long amount of time, it can have detrimental impact on your health. So there's studies that have found those gym rats. You go to the gym, you hit the treadmill hard, you're like, oh, I was healthy today. I don't know, because you went home and you sat on the couch for 8 hours, right? You could say the healthier option would be go for a walk for 30 minutes and then don't go home and sit for 8 hours. You may go home and sit, but break up that sedentary time, break up that sitting time. Because sedentary time now is just as important. Breaking up sedentary time is just as important as activity. So really, we need to find new, and I think with the 24-hour movement behavior guidelines, we're about to break into something really interesting, but we're going to find new ways to intervene or to design interventions to to really target children's health that don't just singularly focus on activity, right? And that's kind of more where my research looks. I like to explore what we call obesogenic behaviors. Any behavior that you could say is related to obesity. And the ones I always talk about are sleep, diet, activity, sedentary time, and media time or screen time. And those obesogenic behaviors as a whole really are interrelated and interact with each other to produce this obesogenic profile for a child. So it's not just their activity that we need to be concerned about. And if we want to look at the research, our evidence would suggest that we've barely moved the needle on childhood obesity, and our physical activity studies or interventions have been mildly effective, and we spent a lot of money.
Yeah, well, so that's a good segue, and so to just be explicit, try to describe, I mean, as simply as you can, what your work is, your field of research, kind of some of your training, your background, how you got to want to research these things, what you've been trained in, and kind of some of the studies that you're undergoing now.
Okay, yeah. So I would say I'm a childhood obesity researcher. I explore obesogenic behaviors, as I mentioned earlier. So anything that could be physical activity, diet, sleep, screen time, just behaviors children engage in on a daily basis, and how that influences their health. Predominantly, or mostly, I'm interested in their weight status, right? And why I got interested in this field, I'm from Scotland originally. I was a physical education teacher in Scotland. You know, coached a lot of soccer over there. Obviously, loved being around kids. Was loved being active and loved my experiences over there. But I was interested to know, why certain children that I was teaching and coaching would enjoy it more than others. And you begin to make a lot of these little observations yourself, and little do you know, you're collecting all this internal data in your head. Um, Fast forward, I went and pursued a master's and did a master's thesis on some children's experiences in PE and how that related to their activity levels outside of school. And I had an advisor at the time that said, you should go and get your PhD if you're really interested in this. And I went and worked for one of the experts in the field, Dr. Michael Beach at the University of South Carolina, where we met, Brandon. And he really opened my eyes to the world of research and what I loved about it. And a lot of people might, actually I teach a class on this, but the word research is really so broad and kind of mysterious. Like, what is research? And I didn't even know, but what we did essentially when I was at South Carolina is we would go out into the community. This is the part I love because it brought in, I could still touch base with the face-to-face, the sort of teaching, coaching element that I left behind in Scotland. And we go out and we would work with summer day camp staff and after school program staff and teachers, and we would train them to promote a healthier environment for the children that they served. And that's all we did. And we did all these interventions to see if our training was effective. And it was like a train the trainer approach. So I did several years of that. And we went into these programs and we measured on a yearly basis. And we spent a lot of money on these. Were NIH funded projects. And what we found is that we weren't very successful. But what we also found is that these places, these programs, these camps, programs, schools in general are doing okay. We did a lot of, thousands of children, hundreds of programs in schools. They're operating at a pretty good level if you look at some of the outcomes we look at. And if you want to dig into the evidence to look at weight gain in and of itself on a calendar year, none of the weight gain, or a small proportion of the weight gain, actually occurs during the school year. It's actually when children are outside of these of school months is when weight gain occurs. And that's what led me to my current research, which is all about structure and how a child during the summer doesn't have the structure anymore of the school year. And it's not just the literal school day. It's the things that come with the school day. It's the routine in the morning. It's what happens at night, right? It's all the little things that shape the child's day. And that day is somewhat structured. Now, if you look at summer, generally speaking, that structure is removed. So the last few years of my research, and now I'm down at UCF in Orlando, has been looking at how these behaviors that I mentioned before differ on different types of days. How is that structured day or less structured day? And I have something called the structured days hypothesis that would say these behaviors are less favorable on less structured days, like a weekend day. And that's really what this was based on. I looked at all the evidence you could find on children's behaviors, so activity, diet, sleep, screen time, and I compared them on weekdays to weekend days, all the studies that have been done, international, national. I had 180 studies. 80% of those studies showed results that children's behaviors were more favorable on weekdays when there's structure. So that led me to explore this a bit more. The one thing that we're just breaking into now is summer. We don't know nothing about summer. And it's probably largely a function of academia. Professors, a lot of the time as a profession, they like to slow down over summer and they go off on summer vacation. So there's not a lot of research that's been done. But to be honest, where I was trained, we were very active over the summer in our research. And I've continued to try and continue that, obviously, because that's what we're interested in. We want to look at the summer months. It's a long uninterrupted time, much like COVID-19 is right now, where children don't have any structure, you know?
Yeah,
Um,
I'm excited for all the studies that are going to come out after this. It's going to be interesting.
yeah,
But, sorry,
I'm
keep going.
actually in the middle of one right now, and I was very fortunate. I was conducting a small observational study that started the week before COVID-19 hit. And I actually got some heights and weights. I got the kids' BMIs, and I'm going back this week. I'm meeting these children and families in a local park, and I'm getting follow-up heights and weights. And I'll have 8 weeks of quarantine BMI change, which falls in line with my structured days hypothesis. So has this period, this long uninterrupted time of, you could say, lack of structure, how has that influenced their weight or weight gain? Or maybe it hasn't. But these are the types of questions I'm trying to answer, to provide, a bit of information, you could say, to parents and schools. That's the ultimate goal, and maybe change some policies. Who knows? But the message being, we need more access to programs, especially for those who can't afford it during the times of the year where they don't typically operate. Right now, camps do exist during the summer. Programs do exist during the summer, but there are barriers to meeting those, to entry, you could say.
Yeah.
And that's often income. And what do we see over summer? Children who are from low income households gain the most weight over summer. So again, it ties back to this underlying, you could say, investigation I've got of structure. And I live my own life by it. I operate better on a structure and a routine. And we could actually look into some of the adult literature that shows how our behaviors as adults change when we go on vacation. I mean, we experience it, right, on a weekday to weekend basis.
Oh yeah. I gain all my weight back on the weekend. I mean,
Yeah,
just
that's what we
anecdotally,
do.
I'll eat really well when I can plan my lunches, and
Yeah,
I have to wait until 7 p.m. to eat my dinner because I got to wait for my wife to get off work and me to get off work. But on
yeah,
the weekend, it's like, I guess I'm hungry.
yeah, yeah. So you're not having meals at consistent times.
Yeah.
We could really dig into how that affects the biological processes in your body, but ultimately it makes an impact. Your body is on a set schedule, and what usually that set schedule is determined by the weekday. The weekends come in and just interrupt it, and what do you end up doing? You fight it for the first few days of the week, and then you're back on your routine, and then boom, you hit the weekend again. The reason we might not see as much weight gain during the school year is because the weekends aren't long enough to do the damage, right? So one of the
Yep.
major questions I always pose is, summer is basically just one long weekend for children, right? It's just different. So not all children, remember, but from what we can see in the evidence, it's making an impact. So that's really where I'm focused. I would say summer and structure and how that can influence, I guess, childhood obesity. So yeah, I'm constantly pursuing opportunities to study this, and like I said, I've got a small study going on right now, and I have a few grants in review looking at these types of concepts, you could say. But yeah, I mean, the interest, firmly lies in children's health. So yeah, the messages, keep them on a nice structure and a routine. It does wonders.
Yeah, and it brings up to me, and I don't know if if you've dabbled in this field at all, but the diurnal rhythms or circadian clocks idea
Yeah, yeah. So
of
that's a
just
biological argument. Yeah,
yep. So I mean, my expertise and my background is a little more biological
yeah,
and mechanisms, but the evidence is there to say, I mean, maintaining rhythms and maintaining balance or a
yeah,
structure
yeah,
is really beneficial to your own body.
yeah, yeah,
Like just for instance, like your sleep cycle, if your melatonin, the
mm-hmm.
sleep drug, it's a naturally produced drug in the brain. It ebbs and flows and undergoes a circadian or a diurnal rhythm where you
Mm-hmm.
have to hit it at its peak, and
Yep,
then you'll be able to go to bed. If you're trying to go
yeah,
to bed when it's at its valley, you're in a lot of
yeah,
trouble, or it's going to be
uh-huh.
much tougher for you to sleep. So getting on a system or on a structure to where you can you can try to fall asleep when your melatonin's highest, you're going to be able to have a better night's sleep and wake up in the morning. And the same thing of like, then cortisol is coming up in the morning and you want to catch it before it hits its peak. It's these same, like having the structure is just better for you. I mean, it may make you more productive, but that's an outcome where like the structure and the rhythms, like biologically and socioeconomically, I mean, or not socioeconomically, but in society, or just in your ability to be healthy, it's pretty profound.
Yeah, the behavioral and the biological really complement each other, and this is it, right? If you structure your lifestyle, you're essentially, what you're doing is you're training your body to get into the circadian rhythm, or you're basically training your circadian clock, right? That really controls all these biological processes in your body. So your body really will tell you, you don't get hungry because you're like, oh, I think I should just eat now. Your body literally tells you when you're hungry. When you start interfering with that, you're essentially messing up the circadian clock. And like you said, it's the same with sleep, right? The melatonin secretion is extremely important. And we have colleagues at Baylor who have really are looking to explore this too, and we collaborate with them on it. Looking at the circadian rhythm and how, we have this term called social jet lag. And basically it's what we do when we stay up late on the weekend and then go to bed early in the weekday. Our body is adjusting back to its natural sort of circadian clock, because what did you do at the weekend? Oh, you had dinner at 9 p.m. instead of 7 p.m. What did you do? Oh, you went to bed later. And then all of a sudden Sunday night or Monday night comes and you're fighting against it. And it's called social jet lag because there's this adjustment. Maybe that's why Mondays, right, or Monday morning so difficult for some people, right? So what you really want to do is to keep a consistent 7-day schedule so you never deviate so much, so you don't really throw off the circadian clock. And one of the cool things that come out of this is that a lot of us as individuals have a preference, a biological preference, and we call that a chronotype. So I believe my chronotype, I'm an early. What does that mean? I go to bed early and I wake early. I don't mean I go to bed like at 7. I just go to bed naturally earlier, you could say, than maybe someone, if you ask 10 people on the street. Maybe I'm in bed at 9 or 10, right? But I'm up at 6, naturally. I'm tired around 9 or 10. I'm up. I never set an alarm because I just wake up and I'm fine, and it always works.
You're lucky,
like,
son of a gun.
Set an alarm. I'm an early. My wife's probably the same. I think I've trained her into being an early maybe over time. But like my sister-in-law, she's a late. Her chronotype is late. She's a night owl. She likes to stay up later and she sleeps later. So she's trained her body to that, whether she knows it or not. She's trained her circadian clock to be on that. As soon as you bump it off of that, everything goes south, right? You're disturbing the norm. So it's really about finding your norm. And one of the interesting things our colleagues are bringing up is that perhaps we're pre-industrialized, right? Before electrical light, we were probably very different. Our circadian clock was probably very different. It was cued by natural light. It was cued by sun up, sun down. Now we got electrical light. We got the 9 to 5 p.m. We got kids going to school early. There's a lot of things fighting it. And it's just about trying to work society into your circadian clock. And it's difficult because as kids get older, what do they want to do? I want to sleep in. I want to stay up late. But the healthiest thing they could actually do for their bodies is maintain the bedtime and wake time and meal times 7 days a week. And that's one of my main messages for a lot of parents is like, don't celebrate the weekend and be like, oh, you go to bed at 8 p.m. on a school night and you're going to stay up till midnight at the weekend. Because over time, it's really going to be difficult for them to adjust back. It's kind of finding a happy medium,
Well, and I like to say, I have an idea. It's not quite a hypothesis. It's more anecdotally in my own life.
Yeah.
Your body is a lot smarter, but also a lot dumber than you think it is. Is your body
Hmm.
adapts to what you do every day.
Yeah.
So in particular with exercise, the reason why exercises get easier is your body undergoes biochemical changes to
Hmm.
make that activity easier because it thinks or it knows, hey, we're going to be doing this activity every day
Okay.
now.
Yeah.
I'm going to make this the most efficient way to do something. So all of a
Yeah.
sudden, lifting 10 pounds is no longer hard because you've built more muscle, you've increased your range of motion. So now you can lift
Yeah.
10 pounds easier. It's the same
Yeah.
thing on so many aspects. It goes,
Hmm.
all right, well, we're normal food. I mean, evolutionarily based, food is available at 12 o'clock. So I'm going to
Yeah.
be hungry around 12 o'clock.
Yeah.
I can't eat when I'm sleeping. All right. So let's make sure, and your body is going to adapt
Yeah.
to your behaviors because this is what we do every day. And as
Hmm.
soon as you try to balance between that, it can be really good.
Yeah.
In the field of exercise,
Hmm.
changing up, giving variety to your body so that you have a wide range of activities that you can do. But
Hmm.
that's not a good thing for obesogenic behaviors or activities,
Hmm.
or obesity.
Hmm.
Is yeah, you don't want to train your body to always be building fat. You want to train your
No.
body to have
Yeah.
rhythms and to maintain structure.
Hmm.
So
Hmm.
I think that's an
Yeah.
interesting point.
It's yeah. It is. Yeah. It's a very when you really get into it, it's fascinating how over time you can change these aspects within your body, like you said. It's just lifestyles, right? People's lifestyles can, but whether they like it or not, can actually dictate a lot of that. Maybe that a lot of children have to get up super early for school because they have to catch the bus to school, right? So it's a 6:15 bus. They're getting up at 5:45 a.m. Biologically, naturally, 8 and 9 year old probably shouldn't be getting up that early, right?
Yeah.
Pre-society, like it's just not. But if you go to bed at an appropriate time, and this is now the new cycle, it can be adjusted for. But there are studies that have been done that have looked at delaying school start times, especially in adolescence, right? Because when you think about sleep, adolescence, there's a bell curve of sleep. You kind of need more when you're younger, and then you need less when you're older. But it peaks around your late teens, early 20s. But um, adolescents are being woken up in some states super early, and it's just and what are they doing naturally? They're wanting to stay up later, and it's sort of fighting the that you could say these lifestyles that have been enforced, you could say, by school start times. But a lot more needs to be done in that area, because I'm not sure if shifting school start times is the intervention or the policy here, because there's a lot of knock-on effects of that too, right? You're asking teachers to shift their school day, which would maybe impact their lives or their families. Also, what about parents who are dropping the kids off at school? Like, they obviously have that worked into their work schedule, so you're shifting a bunch of stuff.
Well, it is interesting that like it doesn't make sense the normal times that children do go to school when parents are at a 9 to 5 schedule. Why would you let kids out at 2 or 3 o'clock if the adults have to work till 5? I've
Yeah.
always just been baffled by that. Of
Yeah.
like, the reason we have after school programs is because other people are still working. Like, why
Yeah,
wouldn't you
exactly.
just
Yeah.
like, oh,
Yeah.
I'll pick you up after work? That I
Yeah.
just would seem so normal, but that's a little bit tangential. Um,
It's true though. It's a good point. Like, why don't we just make school 9 to 5, or
yeah, I mean,
give
it
them
would make
more,
more
give them
sense.
more recess or something that they don't get enough of these days.
Yeah, at least that would make more sense to me because no kid actually needs to be done at 3 o'clock. But
Yeah.
then, I mean, all my
But the
all my sports teams were right after school
yeah.
from 3 to 5, and extracurricular activities are usually from
Yeah.
then to then. But obviously, it's more nuanced than that. But it never made sense to me.
Yeah. Well, the teachers need time to prep work for the next day and everything, so
Exactly.
they're probably shooing the kids out the door at 3.
All the teachers I know.
I
Yeah.
know in some days I was in Scotland for sure. I was like, okay, we're done.
All right. So the last question that I wanna ask you, a structured one, is if there's one thing, one kind of myth you could debunk, or something, either in your field, or, I mean, because as PhDs we're trained thinkers and we're trained analyzers. What's kind of something you wish you could, if you were king of the world, kind of debunk and stop everyone from thinking and believing? Um, yeah, I'll leave that open ended.
Yeah, it's a good one. I think I think I'll think of a better one once this is over. But
Of
here's my
course.
one. Here's my
Okay.
one. That just because you go out and you exercise, you get your one workout in for the day, which is often how we all think of being healthy, right? Or I'm gonna go and exercise today. And once I've done that, I can eat wherever I want and I can sit for as long as I want. I don't know if this is a myth or anything that needs to be debunked. I just want people to be aware that you know it's really, you can still have a lot of negative health outcomes just even if you go and do that gym session, right? And you don't take care of yourself the rest of the day. And it does sort of tie back to my philosophy on structure. You need to be wary of how much time you spend sitting, right? At a desk, on the couch. You have to break up those long bouts of sedentary time. Just go and get a glass of water, or go and check check an email, or just break up that sitting time. Because if you think just going and exercising for the 60 minutes or 90 minutes, or maybe you do a 2 hour gym session, and then you go and let every other behavior fall off the deep end, you're going to have some health problems. So you just need to be wary that not targeting one aspect of health, whether it's diet, exercise, or sleep, isn't going to get you towards optimal health. It's going to take a comprehensive approach. And I would say, I think a lot of what is out there is maybe tailored more towards diet. Do this diet, it will work, right?
Yeah.
It's often short term. You have to ask yourself, can I manage this over time? And it ties back to, am I considering my whole health on a daily level? And some days are going to be better than others. Maybe you won't get that exercise session in, and that's fine. But at the same time, you can still do other things during the day, such as staying on your feet, breaking up sitting time, doing making sure you go into bed at an appropriate hour. I'd say no one behavior, if you solely focus on it, is going to give you or bring you to maybe where you would like to be in health. And maybe that's the debunk. Don't just focus on exercise. Don't just focus on diet. Don't just focus on sleep. Pay attention to them all. And probably to touch on something you said back at the start, you don't have to go full throttle on one area, right? Or even all areas. You just have to be mindful of them all. They need to be on your radar.
Yeah, information and understanding is super important. You need to know like the idea that working out for 1 hour a day is going to be the cure all. It's like that's literally 1/24th of the day. You could have 23 other hours where you're doing really horrible things for your body, and that's gonna outweigh. Now, I would never say don't do that, because 1 hour of exercise does have dramatic beneficial effects, even
it's
if you do have
0 hours of exercise.
Exactly. But yeah, there are important, you need to know what the rest of your day looks like. And that's always one of my things, is information is super important. You need to know, like, yes, the 60-90 minutes that you worked out today, what is that doing to the rest of your day? You also need to know how much time did you spend sitting on your couch today? How much time did you spend sitting in front of your desk, in front of a screen? There's so much more to health. I mean, it's why that first question I asked you of, like, what's your definition of health, is impossible for health experts to actually answer, because it's like, do you have 3 hours for me to give you my complex opinions on what
Yeah,
health
like
means? Or
your first thought is someone might just say, "Oh, being active,"
yeah,
and here we are. Here we are at the end of or an hour later, and we're back where we start, saying it's not just about that, though, right?
yeah,
But often people
exactly.
think health on a singular mindset.
One, it's such a bother of the the contention between exercise physiologists, nutritionists, dietitians,
Yeah,
psychologists is just going like, exercise physiologists want to say, no, first thing you need to do is exercise, or first thing
yeah,
you need to change is your activity patterns. A dietitian
yeah,
will say, you'll never do anything unless like you can never outwork a bad diet. And
yes.
psychologists will say, once you get your mind right, like,
You can do
but it's,
everything. Yeah,
the truth is it's all three of them
it really is.
in one fashion or another, and
Hmm.
yeah, interrelating all of them and balancing the three of
Hmm.
them, not even balancing the three of them, but incorporating the three
Yeah,
of them together.
yeah,
and and that's like, I hate the idea of, um, you can't outrun a bad diet, because I can dramatically improve my mental health,
yeah.
with just exercising
Hmm.
independent of my diet. But at the same
Hmm.
time, I can dramatically improve my mental health by just changing my diet without exercising. And
Exactly.
it's like, you have to understand the balance and how the three
Uh-huh.
things are related to each other. And yeah, it's
Hmm.
just changing 1 hour. I mean, I don't want to say it's not enough, but it's not enough. It's more
Yeah,
than
yes.
just,
You just need to understand there's 23 other hours in the day that are just as important, um,
yeah,
and that's often not how it's served up to us, right? It's do this quick high intensity workout one a day, and you'll get abs like this guy.
yeah.
It's like okay, or do
Deal.
this diet, and it's always singular focus. It's not like here's a kit. This might be something we need to provide. Like here's your whole health kit.
Yeah, here's your
Uh,
lifestyle management.
exactly. Yeah. Yeah.
Yeah, here's how we can change your entire life.
Hmm.
Well, do you have anything else you want to say or bring up or discuss, talk about?
No, I don't think so. I think I think we got through all the things that I think generally, well, I'm interested in, obviously, but what I look at when I research, and yeah, it was very interesting to chat with you about this. I haven't been able to do this for a while, obviously with the COVID-19. My class usually listens to my rants, but that's all been changed. So you got to hear some of it today, but yeah, it was great. I enjoyed it.
Well, I enjoy the scientific conversation. It's always fun to get a different perspective, because yeah, I don't work with childhood obesity or any childhood behavior. So it's when it is
Yeah,
a real pandemic, like, I COVID-19 is decimating the world 100%, but so is
yeah,
childhood obesity, and childhood obesity has been decimating the world for
yeah, and
decades.
it's
And
and
it's like,
it's linked to adult obesity. So this is we're talking about setting people up for healthy and active, healthy lifestyles for the rest of their life. That's why that's probably one of the reasons I've stayed with the childhood obesity focus, is that it's early intervention on children to make sure they're growing up to leading a healthy lifestyle. Um,
yeah, and that was actually a theme of another podcast that I did. Was he had you can learn so many bad behaviors in
yeah,
your childhood, whether you come from a low income family, an abusive family,
yeah,
an unhealthy family. You tend to learn these behaviors. How can we then get out of that?
yeah, yeah,
What are some good things? And that's such a tougher task than learning healthy lifestyle,
yeah,
healthy behaviors young, and just going and always just having that a part of your life. Like, I mean, that's why, I mean, people go into sports. That's why a lot of kids go into soccer when they're 4 years old. It's like, well, they may not be able to pick a ball over their head, but they can kick something and it gets them out of the house and running around for an hour.
exactly. Find
Those are
something they
those are
enjoy. Exactly. Yeah, that's
those are
it.
good behaviors that can translate to the rest of their lives.
Mm-hmm. Mm-hmm.
Well,
So
I
important.
appreciate you doing the podcast with me.
No problem. Thanks for having me.
It's always good chatting science with smart people.
It's fun.
But yeah,
Yeah. It was a good
thank you
time.
much, and stay healthy and stay safe.
Yeah. You too. Thanks, Brandon.